So firstly, I would like to thank all of my co-authors, including Nancy, who is here with me on this effort. It was a team effort, and thank you all to those listed here and everyone else who has participated. As Nancy mentioned, we had many people contribute to this work through various consultations and other events, and so this has truly been a group effort across many different people and organizations. Very briefly, for those of you who don't know, 3IE, the International Initiative for Impact Evaluation, is a primarily grant maker. We support the production and use of impact evaluation evidence and of systematic reviews within international development. So we don't only work in health, we work across different sectors. So diving in, as you all know, adolescent health has come onto the stage as something very important in the past few years, particularly sexual and reproductive health. And this has more and more been something that decision makers have been putting as a top priority, and with good reason. But in order for implementers and others to invest in programming that works, we need to know what works. We need to understand the effectiveness. We need to know what works for whom, which populations, and at what cost. And to help address this question, 3IE, with the support of the Hewlett Foundation, conducted what we call scoping work. And what scoping work is it looks at what the current evidence base is for a particular area, and it compares this to what the top evidence needs are within that area in order to prioritize, in order to help prioritize new research investment. So, as many of you know, there has been a lot of work around ASRH, a lot of different reviews, but how this work stands apart from that is in a few different aspects. One, the evidence gap map is a tool online that we will take a look at, and it helps you access existing evidence. So this work focuses just on impact evaluations and systematic reviews. We absolutely recognize the importance for a wide range of evidence, but we want to take a look at in terms of effectiveness. So in terms of evaluations that answer these questions of what effect did this program actually have, we look to these types of evaluations and systematic reviews of those evaluations. We also are focusing just on adolescence. As you all know, there's a wide range of research on a broader youth population and other populations in terms of sexual and reproductive health, but we wanted to understand what evidence exists just for the 10 to 19-year-old population. We also wanted to understand what evidence exists just for low and middle income countries. And so with all of these different aspects, we sought to understand what the state of evidence truly is. So scoping work, that we are a bunch of economists, some of us are, so we like to look at things in terms of supply and demand. So if you think of looking at what the current evidence base looks like, looking at, well, what impact evaluations and systematic reviews do we have? So this is the supply. And we compare this to the demand for evidence. So what do you all, the users of this evidence who work in ASRH, what evidence do you all need to make effective decisions in programming, research, policy, and funding in this area? And so for this supply of evidence, for looking at the current evidence base, I want to make clear right now that we are looking at what evidence exists and what are the characteristics of that evidence. We are not looking at, in this particular work, what the evidence says. Of course, that's incredibly important, but I think you will see as we go along that simply creating a good look at what the evidence base actually looks like is a big enough task in itself. And this provides a lot of good resources for people. And we very much hope others pick up the mantle and take the next steps of looking into what the evidence says, particularly in areas where people have not done so yet. So this scoping work involves a lot of different parts. In terms of looking at the evidence base, the primary input is what we call an evidence gap map. And this evidence gap map was informed by consultations with various experts and consultations with our advisory group. We'll get to that in a moment in terms of creating the framework of the evidence gap map. Looking at, well, what are the evidence needs? We consulted, as I said, a wide range of people, and we also conducted a stakeholder survey. This stakeholder survey was sent out to a wide range of people. You most likely got the email back in the spring, and we asked, what type of evidence do you use in this area? What type of evidence do you need? What programming are you focusing on? What do you think programming is going to look like in the future? Where is it going? Where are we most going to need evidence? This particular presentation is going to focus less on the outcome of that and of what we found in terms of reviewing current programming and that side of things. We are instead going to focus a bit more on the evidence gap map and how that can be a tool for you. But for more information, take a look at our scoping report on that. So let's talk about evidence gap maps. So an evidence gap map created by 3IE is a visualization of the current evidence base. So it catalogs impact evaluations and systematic reviews in an organized manner by interventions and outcomes. And this allows us to see where we have evidence, where we do not, and where are there possibilities for new impact evaluation research and new systematic review research. So I keep on saying impact evaluations, so let's speak about that briefly. So 3IE defines impact evaluations as studies that use a valid counterfactual to be able to attribute impact to an intervention. So this includes both experimental methods, meaning randomized control trials, or quasi-experimental methods that use statistical methods to be able to attribute that change. So an evidence gap map has two different platforms. Primarily, we have what you see here, and we will look at it in more detail later. Primarily, we have this online platform that plots out evidence by, you have intervention categories on your left on the y-axis, and on the x-axis at the top, you have different types of outcomes. And so we take an impact evaluation and we code it by each intervention that is within that evaluation that's being evaluated and each outcome that is provided. And then we populate the map by that. So one study could appear multiple times, and most often does, within a map. In this particular platform, the gray bubbles indicate impact evaluation research, the colored bubbles indicate systematic reviews. And we'll take a look at this in greater detail in a moment. We also have, to be downloaded, we have an Excel platform that allows you to work with this offline. And this is a very similar concept. It just looks a bit different. We just aim to confuse you all. And for this, the darker a cell is, the more impact evaluation research there is. The lighter, the less. And for both of these platforms, when you hover your mouse over a particular cell, you see which studies are in that cell. And on the online platform, when you click on that list of a study, it takes you to our impact evaluation repository. And this repository tells you a bit about the evaluation, and it links you to the article. So to create an evidence gap map, the process is quite similar to a systematic review, meaning we develop a very comprehensive search and screening protocol and screen through a large number of studies in order to identify the appropriate evaluations. But the first step is to build the framework, which you saw earlier. The framework is the list of intervention categories and outcome categories that shape this matrix. And to do this, we consulted with almost 100 people at 3 different consultations early last year. We asked people, well, what is the full range of interventions that can fall into adolescent sexual and reproductive health programming? And what are the full range of outcomes of interest in this area? And this was, as you can imagine, no easy task to compile all of these inputs and conceptualize the wide range of programming that falls into this area. But with this framework and the search and screening that we did, we populated a map and analyzed what we found, analyzed the characteristics of those studies. So the consultations last year that we conducted not only informed the framework, but they helped inform the overall scope of our project. So as mentioned earlier, we focused just on adolescents, age 10 to 19. We focused on research conducted in low and middle income countries. And we looked at impact evaluations and systematic reviews published from 1990 on. In terms of what falls within adolescent ASRH, we did not restrict by topic. For those interventions that fall a bit earlier on the causal chain, so for example, child marriage or girls' education, these affect SRH outcomes, but that effect isn't necessarily measured. There is a wide range of evidence that just measures a girl's education intervention on school attendance. And so for us, this isn't telling us what we're looking for. This isn't telling us, well, what is the impact on SRH? And so for those types of studies, we asked if they provided outcomes specific to SRH behaviors or health outcomes. And if so, we included it in the map. If it did not, if it fell a little earlier on the causal chain, to keep this scope reasonable, we did not include them. I will not go through the intervention and outcome categories, but I encourage you to take a look at them online. So let's take a look at what we found. So with our search process, we identified over 26,000 studies, and we screened through all of these to ultimately identify 131 completed impact evaluations. So again, these are impact evaluations, RCTs, or quasi-experimental studies conducted in low and middle income countries specific to adolescent sexual and reproductive health. We identified 21 ongoing studies from registries online, and 13 completed systematic reviews, and 1 protocol of a systematic review that is not yet published. For this particular research project, 3IE has an appraisal process in which it applies a tool to understand the quality of the findings of quality of the methodology of that systematic review. And so we assign a confidence level that we have in the findings of that review. So for this particular project, we only included those to which we assigned a medium or high confidence in the findings of that systematic review. And for these systematic reviews, again, these needed to be reviews of evidence within low and middle income countries focused on adolescence. Let's check out the map online. So in your invitation, in the email that was sent out to you all, there are links to all of these resources online. So if you take a look at this evidence gap map on 3IE's website, as mentioned before, here you have intervention categories. And at the top, you have different outcome categories. And all of these are organized by, are thematically organized in these broader groupings. And you will notice for the outcomes that these are a bit broad, and this is to simply organize the evidence. There are many different indicators that can fall into any one outcome category. If you hold your mouse over a cell and over a bubble, you will see the different impact evaluations that fall within that particular cell. Meaning that here in this first cell, all of these different impact evaluations measured the effect of provider training and youth-friendly service adjustments on knowledge and awareness of adolescence related to ASRH. And so if you are interested in one of these impact evaluations, you would click in that cell and it would take you to our impact evaluation repository that provides you a bit of information on that particular study. And if you are interested in simply poking around our impact evaluation repository, it has a wide range of search criteria that you can use to narrow down to what you want. As mentioned before, the gray bubbles are indicate impact evaluation evidence. The colored bubbles indicate systematic reviews. These blue ones are the protocol, and the other ones are completed systematic reviews. You will notice this NA in some of these cells, and this NA indicates a place where we don't want to highlight it as a gap. We feel that the theory of change is perhaps too peripheral or extended. One could conceptualize an impact evaluation that would measure the effect for that particular outcome, but for that intervention, most likely not. It's not worth highlighting it as a gap in evidence. And so ultimately, this evidence gap map is designed to be a tool for you all. So we also inserted different filters up here at the top. So if you are interested in, say, evidence in Mexico, you would select your country and update the map to identify only evidence conducted within Mexico. If you are interested in a particular adolescent group, such as girls, boys, any of these you see here, you can filter the same way. Let's take a look at the very young adolescent evidence base. And here we have 16 different impact evaluations that provide effects specifically for adolescents 10 to 14, meaning the study either focused exclusively on that population or the study disaggregated results. In this case, for very young adolescents, it was almost all that the study focused exclusively on adolescents falling within the ages of 10 to 14. Okay. Going back to our presentation, let's take a look at what the characteristics of that evidence base look like. In terms of when the impact evaluation evidence for ASRH programming in low and middle income countries was published, more than half were published in the past 6 years. So we are excited to see this upward trend of more and more evidence. I think you will note that there's a dip at the very end, but this is due to when we conducted our search. We conducted our main search in the middle of 2016. And so this, I am sure, will go up once one includes those in the second half of 2016 and those that were being finalized. In terms of methodologies, you will see at the bottom here we have the RCTs and the quasi-experimental methods that are represented within this evidence base. And we have vast majority are RCTs. In terms of where these evaluations are conducted by region, most of this evidence is coming from sub-Saharan Africa, and some of you may have a guess as to why, and we will get to that in a moment, that a lot of this evidence is coming from an HIV prevention perspective. Taking a look at a heat map to understand where the evidence base is by country, we see that the two countries with the most amount of evidence, with 17 impact evaluations, are South Africa and Mexico. For me personally, Mexico was a bit of a surprise, but this is due to the multiple impact evaluations coming out of one particular program. For example, 5 studies alone for this topic came from Oportunidades data. We see gaps in evidence in West Africa, in South America as well. For these two gaps, we will be fully honest that part of this could be due to our search criteria, that we searched only in English, and this could affect the number of Spanish and French language studies that we identified. There are Spanish impact evaluations in Spanish in this evidence gap map, but we very well could have missed a few. From consulting many people, we don't think it was a lot, but we definitely understand that some could have been missed by this. Looking at this evidence base by intervention category, by far the most amount of evidence is on instructional approaches both in school and outside of school. So these are different curricula on sex education, HIV prevention, etc. Many of these contain components of comprehensive sexuality education, but interestingly, none of these studies evaluate programs that contain all elements of what IPPF and others would define as true CSE approaches. So for low and middle income country evidence, we are not seeing much evidence on CSE programming in schools or outside of school. Looking at evidence by outcome, as we see with other evidence gap maps, most of the evidence is falling earlier in the causal chain. So we have a lot of evidence on knowledge change, attitudes, and some behaviors. In terms of outcomes related to contraception, the vast majority of these are condom use. We found very, very little evidence on LARCs for adolescents. And of this condom use, the vast majority of that was looked at within the context of HIV prevention, not pregnancy prevention. In general, we found little evidence at the parental or family level, very little evidence at the provider level. So for those studies looking at the effects of provider training and of the implementation, the training of providers in terms of youth-friendly services, most of these impact evaluations are not measuring the effect of those types of programs on behavior change of the providers or of parents and family. We wanted to understand also from which lens were the researchers approaching the evaluation of a program? Were they looking at it with a particular focus in mind, even if the program being evaluated was a general sex education program? And looking for this, we noted that half of this evidence base comes from an HIV prevention lens. And little evidence is actually looking at this from a pregnancy prevention or family planning perspective. Less than just about 15 studies look at it from that perspective, and you'll see other study focuses here as well. We also were really interested in understanding if this evidence base is providing effects for different groups of adolescents, given that adolescents are not a homogeneous group, and what may work for a very young adolescent may not work for a 19-year-old, and same goes for all of these different groups that you see here. Most of the evidence for adolescent girls and boys comes from disaggregated results that are not necessarily explained, meaning that the study authors broke down the results by girls and boys, but they didn't necessarily go into detail about why there may be different effects for girls versus boys. Only 3 studies focused exclusively on adolescent boys. And for the rest of this evidence that you see here, a lot of these don't necessarily really explain the theory of change behind why programming may need to be different, may affect adolescents differently. Unmarried adolescents is another example that it just so happens that their study population were all unmarried, but the authors don't necessarily explain why SRH needs and programming may be different for unmarried adolescents versus married adolescents. Okay. Combining what we found in the evidence gap map and what we noted in analyzing the characteristics of this evidence base, combining all of this with the inputs on the demand side of evidence, if you will, with inputs on well, what are the top evidence needs? What programming are people working on? Where do we most need evidence? We pulled out some takeaways for future research and future policymaking and programming. So in terms of the state of evidence, first of all, we need better reporting. There are some fantastic impact evaluations within this evidence space, but there are also a lot of studies that do not do enough to describe the program being evaluated, to describe the theory of change between the program and the outcomes of interest, and to analyze the results. So we hope in the future to see impact evaluations that do enough to describe these important components. And you will see on this slide other aspects that we feel are needed within the evidence base. We need we need evaluations to take gender into account more. We need these evaluations to truly look at how gender norms and other norms may affect outcomes. We need more evidence from more countries. We need more evidence from different contexts, both geographically, but also in terms of the focus of the programming. So we need more evidence looking at pregnancy prevention and family planning, among other things. Something that 3IE always looks for and is often disappointed in terms of looking at the evidence base is, does the impact evaluation take cost into consideration? If we only look at what works and completely disregard whether or not this is a cost-effective intervention, or if it is entirely too expensive to even make sense, particularly within a low and middle income country context, if studies don't take a look at that aspect, then we are just shorting ourselves. We are missing an important aspect of evidence that can help inform those conducting the programming and other investment. So in terms of looking at the priority gaps in evidence, where we most need more evidence, there are a wide range of gaps. Despite there being 131 completed impact evaluations, there are still many gaps in evidence. But what you see here indicates some of the top gaps that were noted by those who contributed to this work and what we noted through our different processes. And so this includes studies that look at normative change. Only 8 impact evaluations of ASRH programming attempted to measure normative change of any kind. And so considering the amount of programming that is starting to target this, we desperately need more evidence on this. We need a broader range of evidence, not just for what works at the adolescent level, but we need to understand, well, for the programming that targets the broader enabling environment, for the programming that targets providers, families, parents, what are the effects at that level? Are these provider training actually eliciting behavior change? We need more evidence on gender transformative approaches, rights-based approaches, and health, among others. We need impact evaluation on LARCs, access and uptake for adolescents. We need more impact evaluation evidence on what works for subpopulations, so what works for adolescent boys versus others. And while there is high-income country evidence on comprehensive sexuality education, as in the complete package of that, there is not evidence on that within low and middle income countries. Looking at systematic reviews, by far and large, we need more systematic reviews related to ASRH, and we need more high-quality ones. We took a look at where we have clusters of evidence and no systematic review evidence, and we identified, among others, these top 4 areas for which we need systematic review evidence. And so this includes evidence on approaches related to family mobilization and working with the family in the broader enabling environment, related to peer-to-peer approaches, cash transfer programs, and we do have enough evidence to begin to synthesize it for what works for very young adolescents. There's an opportunity there, and we very much hope someone begins to look at that evidence base specifically to help inform programming that is now targeting just that age group. So beyond these gaps in evidence, how else can this research be used? So overall, this evidence gap map, the scoping report, the evidence gap map report, these are all meant to be a tool for you all. These are public goods. We want you to use them, and we are very happy when you do. And so please reach out to us. Do not hesitate to say, hey, we're going to use your evidence gap map in this manner. We love to hear that and would be very interested in that. Please download the Excel version of the map and use that Excel version framework. You can overlay your own programming, your own process evaluations, qualitative evidence, anything else to better understand this evidence base. Please use the evidence gap map online to link yourselves to the individual studies for whether it is a particular country or subpopulation, so that you have direct access to the evidence that you need. And for us, our next step is we are very much hoping to create a grant window to be able to invest in filling these gaps. So we are looking for partners right now to be able to do that, to be able to start filling in these gaps, not just in impact evaluation evidence, but also in terms of systematic reviews, gaps in synthesis. Okay, so this is a relatively brief overview of a very large project, and there is a lot more information in the scoping paper and in the other tools that are on our website. So please do not hesitate to reach out to us with any questions, or please let us know when you use these resources. Additionally, Nancy and I and the broader team are very happy to come to your organizations if you are in Washington, D.C., or when we are in other places. We would love to do a brown bag with you to just stop by and walk you through the evidence gap map and how our results can help you and your programming, research, and other work related to ASRH. So please let us know. We always would love to stop by. And at this time, please, what questions do you have? And it sounds like we already have some questions. So if you will give me a moment while I work with this. Just a moment. I apparently can never quite figure out this webinar software. So we have a couple different questions Firstly, when you say that we need more evaluations to look at how gender norms affect the health outcomes or behaviors, are you referring to controlling for society community norms or the individual attitudes and beliefs? It seems that there are evaluations of the latter according to your map. So yes, that's absolutely true that we do have a lot of evidence about individual attitudes and beliefs, but so more so the former, that we want a desire has been expressed to us for more evidence on not only how norms, broader social norms, affect these adolescent attitudes and behaviors, but then also, well, how does programming affect changes in these norms at not only the adolescent level, but also at the broader community or family level? Let's see. Other questions? So youth-friendly service adjustment, yes, this means youth-friendly services. So we wanted to clarify within the intervention that the intervention is working with providers in order to make services youth-friendly. So the adjustment is just a term to clarify that. So how do you define systematic reviews? So we look for studies, well, that firstly identify themselves as systematic reviews or use methods. And I would encourage you to take a look at our resources on our website. There is a tool that identifies characteristics of a quality systematic review. And this includes a comprehensive and systematic search strategy and screening process. So that means we look for studies that searched a broad range of databases, gray literature, and other resources that had a very comprehensive strategy of going through all of the different results that they found and independently reviewing two different reviewers reviewing studies, the whole gamut of these different aspects that make a quality systematic review. In terms of updating the evidence gap map, an excellent question. I would love to, but it currently an update does not fit into our current capabilities and our current program with this. So we very much hope to be able to do this someday. And if you know of someone who may be interested in investing in this, we would love to chat with you. Yes, in terms of recording the webinar, we are recording it and we will be sharing it. And this PowerPoint presentation as well. Yes, thank you all. Any other questions that I am missing at the moment? It seems that there are no other questions. If you take a look in the questions, is it in the questions, Nancy? So Nancy is resharing my contact information and how you can connect with us. So again, please reach out to us. We'd love to stop by just for a brown bag or something along those lines. We have another question. So what advice would you give to applying this to current research? In terms of current impact evaluation and systematic review research, we very much hope that you take a look at our scoping report and other research as well. Take a look at our scoping report, to see what we are saying in terms of where those priority gaps are, where we see new research can best contribute to the evidence base. I very much hope that new research takes into consideration these other aspects that aren't necessarily being addressed in terms of geographic diversity and in terms of reporting, of fully explaining programming and theories of change. But in general, for anyone, please just use the evidence gap map. Poke around and see what's already out there. Let us help you skip a step in terms of conducting your lit review. Please use the evidence gap map as a way to quickly identify what's there. We hope that it saves you time and it saves you the effort of searching for these. The map is not showing up on the website. Okay. So some excellent questions. Thank you, Judith, for that one. In terms of a review of the results of all of these studies that are within this. Ultimately, this comes down, as you all know, to funding. So again, looking at this state of the evidence was most definitely a big enough task, a big enough scope of work for us. So in terms of next steps, we very much hope that researchers will look to filling these gaps and that foundations and other grant makers, other funders will see these and will help facilitate the production of new research. So we hope that in terms of looking at the results of these studies, we hope that others will conduct systematic reviews in these areas that are unsynthesized. We hope that others will start taking a look at these. And if someone does begin to do this on their own, whether it's an organization or an academic, please let us know. We'd love to work with you and help you in any way we can. In terms of evaluations that we thought were particularly strong, off the top of my head, I cannot think of any, but please definitely take a look at those that are there. And yes, taking a look at another question from Judith. If people want advice on what programs work, can they use this repository? And yes, it is not blatantly there. It is not the first thing you see when you use this. There are, as you all know, there are many other resources that do pull out the results. And so in terms of looking at that, those are great and there's opportunities for more. But you can use this evidence gap map to click on research that takes you to a particular study and tells you for that particular intervention and outcome category, say what falls into one cell, you can click on the research and get to the original studies. So a note on a study that appears in many cells. So this is correct. Some studies, if they have multiple components, multiple interventions within one program, and if they evaluate a wide range of outcomes, then that one study is going to appear many times on the map. Okay, we have another question. Do interventions with faith-based organizations and leaders fall under the outcome categories of community and CBOs? Were there studies that address faith-based orgs at all? No, there were not. No, the ones that fall under community and CBOs were not faith-based. And yes, that's an excellent point, that there's definitely programming conducted by faith-based organizations, and that could be potentially interesting research that does not yet exist in terms of impact evaluation. How many individual studies are included in the map? 131 completed impact evaluations, 21 ongoing impact evaluations, 13 systematic reviews that are completed, and 1 protocol. In terms of the ongoing studies, the ongoing impact evaluations and systematic reviews, we coded the studies, meaning identified the intervention and outcome categories by what information we had online. So this primarily came from protocols that were published or registries, say from clinicaltrials.gov, registries of impact evaluations. If we saw something that looked like maybe it was an ongoing study, but we had absolutely no information to code it, we did not include it in the map. Any other questions at the moment? It appears to be it, but please do not hesitate to reach out to us. We'd love to chat with you more about this. For those who, particularly, thank you to all for being here, particularly for those who have been involved in this in the past year. Thank you again for your input. Please let us know if there are opportunities for this to be used. There are places that this would really help. We want this to be a tool and to be the first step in not only investing in new research, but the first step in, as some of you were saying, the first step in looking at what that research says. So we hope this is a way, so it's not just plucking the few evaluations that are identified easily in a quick search and looking at their results, but we hope, as this is so comprehensive and systematic, what fell into our inclusion criteria, we hope then this is a way for you to access the full range of impact evaluation evidence for any particular intervention within ASRH. Thank you, and thank you all, and please feel free to reach out.